Hi everyone, I wanted to go ahead and finish up your Chapter 6 PowerPoint. I'm starting on slide 23. We have about 12 slides to finish. This is all information that will be important for you to know for your test, which is Wednesday, June the 8th. So we now want to start talking a little bit about histamines or antihistamines. These are also known as histamine blockers. So remember, antihistamines reduce inflammation by preventing inflammatory mediator from binding to its receptors. And there's a couple different types of histamines that we talk about in the body. And so these obviously cause changes that lead to inflammatory responses. So you might hear H1 receptors talk about and H2 receptors talked about. So as far as your H1 receptor, when histamine binds to this H1 receptor, tissue changes occur, which cause blood vessels to dilate. They cause swelling, decreased blood pressure, poor heart circulation, narrowed airways, increased mucus production, and also the formation of hives on the skin. And then when histamine binds to H2 receptors, stomach acid production increases and the risk for stomach ulcers is greatly increased. So both are most commonly used for inflammation triggered by allergic reactions, such as hives, watery eyes, and runny nose. One of the antihistamines, Benadryl, is given during anaphylaxis and other severe systemic allergic reactions. So we give antihistamines with the intention that they are used for either, like I said, allergic reactions, or sometimes they're taken as a sleep aid. Tylenol PM is the combination of Tylenol and Benadryl. Okay, so it's a dual drug, and those are the two drugs that make it up. So Tylenol and Benadryl, and that's used for sleep. So why do we want to give a patient an antihistamine, or why would we take an antihistamine? Well, antihistamines are intended to make sure that your blood vessels do not dilate, that there's reduced swelling, reduced mucus, especially in the nose and eyes, that your respiratory secretions are decreased, your narrowed airways widen, and your hives decrease in size and itchiness. However, side effects of it are sleepiness, dry mouth, blurred vision, tachycardia, and urinary retention. So let me ask you guys a question. Considering the side effects and adverse reactions, which patients should not take antihistamines? So what patients are they kind of contraindicated in? Well, these would be patients that have glaucoma, prostate enlargement, hypertension, and urinary retention. And as far as adverse side effects, you may see patients develop seizures, which are very rare, but also increased intraocular pressure. So for those of you who love to look at a visual to learn, you'll like this slide. So you'll see here, histamine is the main mediator of inflammation and capillary leak. And leukotriene, another mediator that binds to a receptor, works with histamine to keep the inflammatory response going once it has started. Okay, so what are things that we need to check when we administer an antihistamine? Well, we need to check before to make sure that the patient doesn't have glaucoma, high blood pressure, or prostate enlargement. Okay, we also need to check to see what other sedatives or drugs that the patient's on that cause sedation. Okay, so what other drugs, for example, may cause sedation that your patient would be on? Well, any opioids, any sedatives, any muscle relaxers, and barbiturates. So what should you do if the patient is prescribed another drug that causes sleepiness. Well, the main thing that you need to take into consideration is that you should not give an antihistamine within 4 hours of them having these other types of drugs. Okay, afterwards, we need to make sure that we check the patient's vital sign and also assist the patient when getting up out of bed. If it's the first time that the patient's ever taken an antihistamine, we definitely need to contact the prescriber if they have any vision changes or pain over their eyebrows, because this could mean an increase in that intraocular pressure, which is one of the adverse side effects of antihistamines. Also, patients that have asthma should not take antihistamines during an acute asthma attack at home because the drug could cause enough sleepiness to impair the ability to breathe. As far as patient teaching is concerned, we want to tell the patient to avoid alcohol because alcohol is a downer or a depressant. And so antihistamines already cause drowsiness and sleepiness typically. And also they need to avoid driving or operating machinery within 6 hours of administration. Also, you really need to urge your patient to contact the prescriber immediately about any vision changes or pain over the eyebrows, which again could mean an increase in intraocular pressure. Okay, now we're going to talk a little bit about leukotriene inhibitors. Okay, leukotriene inhibitors work in several ways to prevent an asthma episode. So we typically want them to reduce swelling of oral, nasal, eye, respiratory mucous membranes, and we want them to reduce secretions. So, few different leukotriene inhibitors. So there's Xolutin or Zyflo. This prevents leukotriene production within the white blood cells. And then you have montelukast or singular and zafirlukast or alkylate. They block the leukotriene receptors on the cell. So in other words, they're all examples of leukotriene inhibitors. However, they work a little bit different to help to prevent those asthma attacks. Now, these leukotriene inhibitors, if you would give them to a patient with allergies, they would definitely have less of an inflammatory response. Typical side effects are headache and abdominal pain, and then very adverse, which are bad or rare side effects, or liver impairment, and also allergic reactions, and that includes hives and anaphylaxis. So when we administer a leukotriene inhibitor, we want to make sure to see if your patient has any liver problems. So what signs and symptoms may the patient exhibit that would indicate that they potentially have liver problems? Well, things like jaundice, tenderness in the right upper quadrant, nausea, and fatigue, although those are pretty nonspecific symptoms for a lot of things. And also afterwards, we want to, let me back up. One thing we need to do is we're checking for liver problems besides assessing the signs and symptoms. We also may need to look at the patient's liver function test, their blood test, ALT and AST, just so we have a baseline, because after administration, especially long-term administration, we are going to continue to observe for any liver problems. So the patient's going to need regular follow-up, and then we're going to probably, or the prescriber is going to check that ALT and AST again periodically, and then compare to that baseline liver function test that they got prior to the administration of leukotriene inhibitors. As far as patient teaching, we want them to report any symptoms of liver problems, which we just discussed those symptoms on the previous slide. And we need to make sure that we take into consideration lifespan considerations. So, for example, with pediatrics, we want to make sure that we give very calculated, correct doses for children to avoid any overdose. Also, keep in mind that these meds on an elderly patient who has impaired liver function we really need to be teaching and monitoring very closely. Okay, the last type of meds that we're going to talk about are disease-modifying anti-rheumatic drugs. You may also hear these medications referred to as DMARDs, DMARDs, which is just an acronym for disease-modifying anti-rheumatic drugs. So these drugs are commonly used in people with rheumatoid arthritis because they reduce the progression and tissue destruction of the inflammatory disease. So some of these medications that are DMARDs meds are also used in treating other conditions, typically your autoimmune conditions like psoriatic arthritis and systemic lupus. So how do they reduce the progression and tissue destruction of inflammatory disease? Well, the first thing they do is they inhibit the tumor necrosis factor, or TNF. They are antibodies to TNF. They bind to TNF molecules and prevent them from binding to receptor sites on specific white blood cells. So what do we want them to do? Well, we want them to reduce pain and other symptoms. They want the patient's function to be improved, and they want to reduce or delay the progression of the damage of rheumatoid arthritis. As far as side effects, some of these medications are given by injection. So you may have injection site reaction, headache, and nausea. And then as far as our adverse or bad side effects, they cause reduced immune function, anemia, bleeding problems, heart failure, and they can also cause allergic reactions. So other adverse effects are also can be depression and suicidal ideation. So we want to make sure that if we have a patient with a history of depression who's taking a DMARD drug, that they are very closely monitored for any thoughts of suicide. Also, our patients with very poorly controlled or very severe heart failure are also really not good patients to take these type of medications. Okay, before we give these meds, we want to make sure that the patient does not have an infection. If there is an infection present, typically the therapy is delayed until the infection is gone. We also want to make sure that if we're giving an injection, we inspect the vial or syringe for the correct dose. We need to make sure that the expiration date has not passed. We also, after we administer the very first dose of the medication to the patient, we need to watch for any adverse reaction. And then as far as afterwards, we need to observe the patient for 2 hours, assess their breathing, and also their blood pressure. As far as patient teaching, again, they need to know signs of infection, that they need to report any signs of infection. If they're going to be giving themselves these injections, because lots of these meds, like I said prior, are injectable, we need to teach the patient proper technique, and we need to actually, when we teach them, show them how, and then do a teach back where they show us how they would do an injection. So not only do we teach them, we need them to kind of do a demonstration so we can make sure that they're using the correct technique for a subcutaneous injection. Okay, so lifespan considerations. As far as that, we talk a little bit about pregnancy and lactation. So some of these medications like adalimumab and etanercept are safe to administer during any trimester. However, some other ones may cause birth defects and are contraindicated, and there's no contraindications for use during breastfeeding. let's see. I think that's it on those. If you guys have any questions, please feel free to reach out to me via email. Thank you for tuning in. I kept it shorter than I thought at 15 minutes, but if you have any questions, please let me know. Otherwise, I will see you Wednesday for your test. Thank you.